Hello and welcome to Tobacco Cessation class. So this video will help you with your tobacco cessation assignment, the video assignment that you have to do. The information from this video should help you with how you are to go about and do your assignment. So we have some learning objectives over here. Let's just introduce you with some terminology. So tobacco cessation basically means, when I think of cessation, I think of quitting. Tobacco cessation is when someone quits smoking, when someone quits using tobacco. Tobacco dependence, that's when someone is addicted, depends highly on smoking, depends highly on tobacco. So we all notice there are lots of systemic health effects. Systemic means body. Okay, so lots of effects that could happen in your body. You could get cancer, and not only lung cancer, you could also get oral cancer in the mouth. You could have heart problems, high blood pressure, stroke, your lungs could get blocked. So lots and lots of bad things that we all know can happen when we're smoking. Some people may think, oh, I'm not smoking, but I'm using shisha or hookah or water pipe, which is this thing here. Or I'm just using e-cigs or vaping, which is this over here. The textbook says that hookah or shisha is still bad. There's still lots of side effects that could happen. There's been documented cases of cancer, including lung and oral cancer, that's happened because of hookah. And same thing with e-cigarettes. Yes, e-cigarettes is better than using a regular cigarette. However, there still is some negative effects happening with that. So the goal is to avoid using tobacco, avoid using any type of cigarettes. In fact, think about when, if you've ever had to fill out a life insurance or a health insurance form, one of the questions they ask is, are you using any forms of tobacco? And they include hookah. They even include electronic cigarettes as well, because if you do use those, that can affect your application for life or health insurance. So when you look inside a smoker's mouth, sometimes you could see these white patches, and these white patches are called nicotine stomatitis. This is caused because of heat. So this usually happens with people who smoke with a pipe, because when you have a pipe, it could really damage your palate over here from the heat. We know that when someone uses tobacco, it could also cause periodontal disease. You could get gum recession, bone loss, lots of bad things that can happen. People who are addicted to nicotine, there are definitely some signs where you can tell when someone is addicted to nicotine. And some signs are that as soon as they smoke, they feel so much better. It's like a very pleasant, euphoric feeling that they have. They can't quit. It's very hard for them to quit. They have strong cravings for smoking, for tobacco. They're dependent on it completely. And if they do quit, there's a high chance that they could relapse, that they could start smoking again. So we usually use the 5 A's approach, where we ask our clients whether they smoke. We advise our clients to quit. We assess them to see if they're ready to quit. We assist them with quitting, and then we arrange a follow-up. So I'm going to go over these. This is a good video of how the 5 A's are used in a clinical setting. So I do encourage you guys to watch this. This may help you with your presentation. So the first thing is ask. When we do a health history, one of the questions that might be there is, do you smoke? And the reason is because we need to ask whether they smoke. And we need to advise them. So if they do smoke, we want to tell them to quit in a very non-judgmental way, because if you get judgmental with them, they're not going to appreciate it, and they might just walk away. So we would encourage them to quit, and I'll show you later on how we could do that. If they don't smoke, then praise them, and if they used to smoke and now have quit, praise them. Tell them that that's amazing. I'm so proud of you for staying away from tobacco. This is a cool thing to do. It's called the stop, look, listen approach. So if they're smoking, tell them the importance of stopping to smoke in a very caring and compassionate manner. I can't stress this enough. You need to be very caring and compassionate. Then show them, and this is the really important part, in their mouth, they might have nicotine stomatitis. In their mouth, their teeth might be stained. In their mouth, they might have gum recession. And all this could be caused because they're smoking. If you personalize it and show them the effect that's happening in their mouth, that could maybe create an incentive for them to quit. And then listen to them. Right? You're not doing all the talking. You want them to also talk and explain the reasons of why they want to quit or don't want to quit. So when you assess, you want to ask if they're ready to quit. You want to assess to see if they're ready to quit. And if they are ready, we're going to give them assistance, which I'll show you how to do later on. And you could even give them a referral. If a client has so many other problems going on and needs intensive treatment, then we may not be able to offer tobacco cessation, especially if they've got other health problems and stuff. We can just refer them to a doctor who can guide them to where to go. If a client is not ready, then we're going to give them motivational intervention. I'll talk about this later on, and give them a brochure, a pamphlet of why they should quit. Now, I've done this in the past, and I've had situations where the client just threw the brochure right in my face. And that's okay. As long as you do it in a nice, caring way, you have done your part. And that's the bottom line, that you did your part, you educated them, and then the rest, it's on them. But make sure you do it in a non-judgmental way. Assist them. So let's say they're ready to quit. Then come up together with them. You come up with a quit date. So usually we say 2 weeks. So 2 weeks from now, that's it. No more tobacco. Okay, and then we would encourage them to tell their family and friends so that they get support that way. We would tell our client, that it's not going to be easy. There will be challenges. There will be withdrawal symptoms that you'll go through. So you could feel anxious. You could feel that you get irritated very easily, and that's okay. We want to tell them to remove tobacco from their environment. So even if they have cigarettes in the car, we want to make sure that they get rid of that. If they go to their friend's house and the friend's always smoking, we want to tell them to stay away from them for now. If they quit before, figure out what helped them quit so that you could use that same method again. And then if they relapsed, why did they relapse? So that maybe when they tell you, maybe you could figure out a way to avoid that, to prevent them from relapsing. They could use nicotine patch. There are some drugs that they could go to a doctor and get to help them with quitting smoking. So lots of ways we can assist them. We need to arrange a follow-up. So once they said that they're quitting 2 weeks from today, for example, then on that quit date, we're going to follow up with them by phone, or they could come in and you can book an appointment. And you can say, okay, today's your quit date, just following up to make sure that, you've removed all the tobacco from your house. If you need any encouragement, please let me know. We're here for you, that sort of thing. So you would do it on the quit date. You would do it again 1 week from the quit date. You would follow up with them, and then you do it on the first month after the quit date. And if you want, even the second and third month after the quit date, and congratulate them. If they have abstained from tobacco this long, you want to congratulate them. But let's say that it didn't work and they started smoking again. If they started smoking again, then what you can do is do the whole thing over again. Set a quit date. Maybe now they could start going to the doctor and get a prescription for a drug that could help them quit if they did do so. And maybe there are some agencies that are out there. You could give them the contact numbers to those agencies, like Smokers Helpline, for example, and they could guide them and do more intensive tobacco cessation with them. So people who have no interest in quitting are in the pre-contemplation stage. People who are, thinking about quitting, maybe not now, but maybe the next 6 months, they're in the contemplation stage. People who are thinking of quitting now and willing to create a quit date 2 weeks from now are in the preparation stage. People who have quit up to 6 months, so they quit smoking, and it could be the first month, second month, third, fourth, fifth, or 6th month. If they're within the 6-month time frame, it's an action phase. Maintenance phase or stage is after 6 months. So they have quit smoking for 6 months, and now they're in the 7th, 8th, 9th, 10th, right? All any amount of time after the 6 months. If they quit smoking after the 6 months, they're in the maintenance phase. And finally, relapse. Relapse is they quit smoking for some period of time, and unfortunately now they went back to smoking. So these are the stages of readiness.